My vision and the vision of the people in this room is that Oregon can and will have a better healthcare system that actually improves the health of our citizens at a much lower cost. Pioneers are the men and women who have actually set up these new coordinated care organizations. They are Republicans and Democrats in the Oregon legislature, and really citizens all over the state who basically stood up and had the courage to say, look, our healthcare system isn't working. It's not working for business. It's not working for families. It's not working for Oregon, and we're going to design a better way. In the 15th century, when they were drawing maps of the world, there was all these white areas, you know, where they didn't know what was out there, like the east coast of the North America. And they'd write, there be dragons here. It was really the unknown. And the amazing thing about these coordinated care organizations, the amazing thing about Oregon, is that we are going to be able to fill in the white area on the map. We're going to be able to design what that is. And, you know, it's exciting. It's terrifying, I suppose, because it's the unknown, but it's incredible because we get to define it.
The problem is actually pretty simple. Healthcare has become too costly for everybody. It's become too costly for individuals to buy health insurance. It's become too costly for the state to be able to care for the most vulnerable, and it's become too costly for businesses to cover their workers.
Well, the problem is not just in Douglas County, it's throughout the country, and that is that we have care which, although we spend a lot of money on care, it's not as good as it should be.
I had a patient who ended up in the emergency room with something called sepsis, which is an infection of the bloodstream. He was in the hospital for 3 months. 2 of those months on dialysis with permanent kidney damage and a valve replacement of the heart because of infection in the heart. Cost probably $500,000, all caused by dental decay and infection from his teeth getting into his bloodstream. When I got him back to my office and looked at him, his teeth were still infected and rotten, and no dental care had been given to him in the hospital or anyplace else.
I don't think we're getting the results that we had hoped for. I think that what we're doing is not creating healthier communities or healthier people, and I think the system's fragmented and difficult to navigate.
That lack of coordination and integration is leading to horrible outcomes, new heart valve, lost kidney function, and maybe losing the kidney someday, huge costs, and not a healthy person.
You usually don't expect something to get better when you try to cut costs, but that is the new model of healthcare that could lead the way for other states, as long as Kitzhaber can deliver results.
We pay on a fee-for-service basis, so we pay providers for every procedure or every test, or we pay to fill hospital beds. That doesn't necessarily yield better health or better outcomes. So a lot of the payment models that we're looking at are starting to evolve, are actually starting to pay on quality, not necessarily on volume. And that really changes the game.
Right now, our healthcare system is really based on more and more care, not better and better health. So this is about changing that so that the focus is A, on health, and B, on being fiscally responsible and sustainable.
Coordinated Care Organization is an entity that will bring together both physical health, mental health, and chemical dependency and oral health services across all transitions of care.
We have to create plans of care that are distinctly tailored to the needs of each individual based upon their demographic status, their health status, and connect them to the right delivery system to provide high-quality, affordable care.
Let's say you have a patient who has been going to the emergency room 2 or 3 times a month with uncontrolled diabetes, and the problem that patient has is really a mental health problem. Their diabetes could be controlled if you dealt with their mental health problem. When you have a CCO with a total budget, that CCO is going to say, hey, wait a minute. This individual patient's real problem is their mental health. Let's resolve that, spend some of this money over here as a better investment of that money at a fraction of these costs, and end up with a healthy individual who can function in our society.
We will learn that there is a science to how we coordinate care. It's just not something that's intuitive. It's something that we can study and improve in a very prescriptive and conscientious manner.
The power of electronic health records will allow us to embed care protocols that are tailored to the individual.
Care coordination in Oregon is an opportunity for us to demonstrate how this type of approach to healthcare and the delivery system can really be better as far as outcomes for patients and families, more efficient, more effective, and it can be a model that could be emulated across the nation.
It's incredible what Oregon's done at a time that's as contentious as any time in my lifetime in our nation's history, politically. When people are having trouble sitting together and making important decisions, Oregon's doing it. You've produced bipartisan legislation. You've got a vision about the direction of healthcare in this state. You're going to reach out and really improve your Medicaid system, make it sustainable and better for everyone. I mean, it's really remarkable. It's almost unique in the country right now, and I'm so excited about what's possible here.
I think it's about individuals building a relationship and being focused on the same end goal. Tim and Alan and I all knew that it was up to us to make sure we could get the bill done because we needed to for the budget. We needed to do that for all of Oregon, and it was all about how we could work together as people.
Representative Kotek and I are probably as far apart on the political spectrum as you might imagine. But interesting enough, it didn't take very long for me to realize that Tina has a very deep caring for the people she represents and to try to make things better here in the state of Oregon, and hopefully she saw that in me.
I remember Tim and I looking at each other thinking, thank God we don't have to have any more meetings on this bill.
Those are pretty, these are a little softer, these are from Capitol, so I'll get you a copy of those. If everything works great and it's perfect, that's the part I did. If there's problems and hiccups or things that need to get fixed, that's the part that Senator Bates and Representative Kotek did.
We wouldn't be here today if we didn't get the encouragement as well as the push from the legislature as well as from the administration in the state to say, you know, there's only so much money that we have available. Is there a better way for us to do this?
We started with a little breakfast group about 2 years ago, and we just had breakfast. But then after a year or so, we decided we really wanted to do more and really form the group that's the CCO. And it's the hospital administrator and the county health administrator and our county commissioner and various other healthcare people from the community getting together and deciding that we're going to do this and really make healthcare in Douglas County the very best we can do.
We're really fortunate in the state to have that many people that passionate and engaged and really driving this from the heart.
Oregon really is Oregon, and it's different from Washington. I've spent 15 years in Washington state. I think there's a greater sense of community here. It's a smaller state, people know one another, and I think that makes the difference.
When I'm sitting at the table in these meetings, I feel like I'm representing all Oregonians. Obviously I'm representing the patients that we will treat, but I'm also, I think, representing every citizen of the state in that it's the state's obligation to develop a system that can indeed treat all.
If we did this together, we, one, could probably do it less expensively, so more affordable, and two, we might learn from each other. What's worked for you better than what's worked for us? And three, what resources do you have that might apply better to these people than what we have?
if your mouth is open, your ears are closed. And so the other lesson that I think that I have taken away from this journey is it's far better to listen and to make sure you understand first.
The reason that I am really passionate about healthcare reform is that for me it isn't about just the care. It's not the medical costs. It's about the opportunity to truly help shift the curve about healthy communities and healthier people.
And I think the really big important piece for it is this is really important for employers. It's important for businesses. The cost of healthcare is a barrier to economic growth. This is really going to help our businesses succeed and help our economy stay on track. And so I don't think we want to miss the economic impact of this bill. It's very important.
This is not a sudden blossoming of a healthcare reform. It's been going on for a long time. A lot of people have worked very hard on this. I especially want to mention tonight someone who's not here with us who has been a big part of that. That was Senator Ben Westland, Treasurer Ben Westland. He's looking down at us now, probably smiling, because of his vision and dream, which was my vision and dream, have now occurred.
You know, our nation needs optimism. We're a smart enough country, a good enough country to be able to shape the health care we want and need at a price we can afford. We're spending almost twice as much as any other country per capita on health care. Surely we can do things for our citizens, but to have the confidence, we need the results. We need the examples of success. And Oregon can be a beacon. It's being watched, whether you like it or not. Oregon's being watched now. The nation's eyes are here because the journey you've set out on is so exciting and so important as an example for our country. If Oregon succeeds, I think it'll be a legend, and that's what I want to have happen here.
We're going to make this work because of Oregon and Oregonians, because we had the capacity to come together in one of the most difficult economic times in our history and to put the common good above the good of the party, to put policy above politics, and to make this about people, and to recognize that we're all in this together, and the only way we're going to get out of it is together. It's very gratifying to be governing at a point in time when Oregonians have risen to that challenge, and I'm really proud to be a part of it.
You want a revolution, well, you know, we all want to change the world. You tell me that it's evolution, well, you